and make their lives safe. Using Dr. Mashriki's example of success, we also used some intervention, and we evaluated that using the barrier between the two rooms, preventing children going from one room to another room where the activity of cooking is going on and mother is busy with her everyday chores. We documented that it successfully prevented almost 100% burns. There were only 2 injuries, and it occurred in those homes where they were not using the barriers for some mechanical reasons. The playpen was used in houses which had only one room and a barrier could not be put. We have done only a 1-month survey, and we need to evaluate on a long-term basis the outcome of this. And secondary prevention, I conducted this is a poster that we have designed to encourage information on extinguishing fire by stopping, dropping and rolling, which extinguishes fire and reduces the extent of burn, and then by pouring water on the burn, it cools and prevents the depth of injury. So this way we are able to do secondary prevention. A little push in the right direction after this, in the right direction towards tertiary prevention, can make a big difference. And these are the superficial burns. If on admission we can do some biological dressing which clings to it, the patients heal beautifully, they can go home, there's no pain, no antibiotic required, no hospitalization required, and they almost heal completely within 10 to 12 days. And the patients who are deep dermal and full thickness burns, we excise them, graft them, and look at the results of hands. If it is a lot of work when you're doing a reconstruction, it is probably 1/4 the amount of work that you spend on doing an early excision and grafting. So timely surgery is very important for preventing complications, and these are some of my happy survivors of major injuries. We still have these patients. This is still a very familiar sight in our country, and they remind us that we have to focus on all the 3 points of prevention. This is from your country, ash burns. At one time we had 25 patients in DMCH of ash burns. I think it's one of the major challenges of Bangladesh. Thank you very much for your kind attention.
Thank you, Dr. Subramanian. Now, question and answer session.
Yeah, I have a question. What is the suggestion to prevent accident? Preventive measures.
Yeah, what Dr. Mashriki has done is, in closing, I think his evaluation report should be submitted to the government, and it should be from the government that throughout the country they should take this project and they should construct these. They should ensure that these things are constructed and a child is prevented from coming to the cooking area. Since everything else is not going to change, the cooking habit is not.
Mainly, the main source is that everywhere except the urban area, city area, rice mill is everywhere. Rice is the staple food here. So wherever there is a rice mill, they use the rice burn or boil it, and after using this, they put it in an open place. We think we have to make a designated place and something by the fence or some wall. Only those that need to be dumped, rest should be dumped some designated area. Otherwise, just make a room that should be a circle.
Yeah, either you encircle the cooking area or the ash dumping area, or cool the ashes. Yeah. But he has already documented good. Thank you.
Our next speaker is Dr. Imrul Hassan. He will be talking on barn from childhood to cultural habit of spending more gardening during the period. Dr. Imrul Hassan. We have 7 minutes, exact 7 minutes.
An accident does not occur accidentally. Always there is one or more root cause for any accident. The nature of any accident varies depending on geographical area, local culture, socio-economic condition, education, and any other facilities, religious belief, and social custom as well. In Bangladesh, we found a special type of accidental burn injury that happened to many young ladies during puerperium period, which is unique in nature. We get a number of cases in which in the hospital, but it's just a tip of iceberg. There are much more higher number of cases cannot go to the hospital for treatment because of many myths. These cases attracted our attention because all of them came from rural areas, from same kind of cultural, economic, and educational background. The injury causes devastating effect not only the mother, but the consequences follows to the newborn baby. Many times the newborn baby dies also for indirect effect of the injuries. Our study period was just 1 year. Total 27 cases were admitted in burn in Dhaka Medical College and Dhaka Burn Clinic. Among them, 20 were primary and 7 was multipara. Their age was between 17 to 38. The area involving the lower limbs, perineum, lower abdomen, and sometimes upper limb too. Most of the cases came to the hospital several days after the incident and obviously were severely infected. Out of the admitted 27 cases, 12 patients died due to lack of proper golden hour management and for the complications. There you can see some cases. Now I'm going to discuss about some facts behind this. 4 babies born in every minute in Bangladesh, and still now more than 80% childbirth occur at home in Bangladesh. We do not have enough expertise to provide antenatal and postnatal care, especially in the rural areas. There are many types of alternative medicine filling the gaps. Some tradition that also causing this type of incidents. After childbirth, perineum warming with fire in a clay pot is common practice in the rural area. In case of home delivery, the mother and baby put in a separate room called atul room. The room of